Hi everyone, and welcome to day 2 of the Durham Women's Summit. It is my pleasure to introduce one of our amazing physiotherapists from Women's Health Physiotherapy Center, Victoria Phillip. Tori is a very talented therapist and a wealth of knowledge for women's pelvic health concerns. She's going to be sharing on what pelvic physiotherapy is and how to know if it might be the help that you need.
Hi everyone, my name is Victoria Phillip and I am a physiotherapist who practices in the field of women's health physiotherapy at the Women's Health Physiotherapy Center in Ajax. I was invited today to talk a little bit about the wonderful system of muscles known as the pelvic floor and talk a little bit about how those muscles actually function. And then basically what may be signs or symptoms to be aware of and mindful of, that if you experience those particular signs or symptoms, that maybe it would be a good idea to have your pelvic floor examined. So first thing I'm going to talk about is probably what most of us associate actually at this point with pelvic floor physiotherapy, which is loss of bladder or bowel control. And so it's important that our pelvic floor functions optimally because basically these muscles, they're controlling, like a sphincter, the opening of the urethra and the opening of the rectum. And so as our bladder and our bowel fills, those muscles have tension there to keep us in control. And sometimes we might experience an involuntary loss of control. There's various symptoms or sort of states in which that can happen. So it might happen with a cough or a sneeze or maybe physical activity. But it can also occur with urgency. So just having to use the bathroom, some people actually on their way to going to the washroom lose that control. And then some people experience both actually. So the good news is that pelvic floor physiotherapy is considered the first line of treatment to address that issue, and it's very successful. So that's always a positive. Now the sort of area I would say that's gaining more knowledge is the next function of the pelvic floor that we'll talk about, which is pelvic organ support. So the muscles attach from the pubic bone to the tailbone and wrap underneath the pelvic organs, so your bladder, your uterus, and your bowels. And so those muscles, one of their most important jobs is just to hold and support the position of those pelvic organs. Now, some women may experience in their lifetime a pelvic organ prolapse, in which case those organs are now sitting a bit lower in the bottom of the pelvis, and there's different degrees of that a family doctor or gynecologist would diagnose. So keep that in mind. But essentially symptoms or signs that you may experience. Now keep in mind you may have these symptoms but not have a prolapse as well, so keep that in mind. But typically women will describe like a discomfort or a pressure that they notice at the vaginal opening. They may even notice, typically when they use the washroom, as they're wiping, they might notice a little bit of just something sort of sitting there, something that doesn't feel like it did before. And so often those women will seek out sort of an exam, and that's maybe when they might be diagnosed with that. And so it can affect various parts of the pelvis. And the good news is that, again, pelvic physiotherapy can be very beneficial to these women in any stage, really, of their prolapse, whether it's something that's, very minimal to maybe something that for them and their healthcare provider have decided would benefit from surgery. Pelvic floor physiotherapy can actually optimize the outcomes of that surgery, which is really, really wonderful. Now, another important function is the core strength function of the pelvic floor. So our core is really a lot of different muscles that are all working together as a team, and our pelvic floor is actually a really important part of that, and it's considered part of the deep core that works alongside a few other muscles known as our breathing muscle, the diaphragm, our abdominal muscle, the transverse abdominis, and the back area called multifidus. And so collectively that unit is giving us a nice foundation of strength to be active. And keep in mind, these muscles work for everything that we're doing, basically. Getting out of a chair, going upstairs, lifting a child. And so we want those muscles to work well and coordinated together. And so signs that maybe your core isn't as strong, you may notice you just don't feel as strong as you did. Some women might report that they have maybe discomfort or just challenge weakness in their hips, their pelvic girdle, in their back, that maybe they've had physiotherapy or other types of care, but haven't really achieved what they're hoping to achieve. So that's something to keep in mind. And then in some circumstances, in a woman, for example, who's had a baby, her abdominal wall, which is connected with the pelvic floor very importantly, may not feel like it is the way that it was before. And so potentially they might be diagnosed with a diastasis recti, which is just when the abdominal wall is sort of separated more than it was before. And so they might notice with certain activities, just like a tissue sort of bulging there or tenting there. And that could also suggest that that deep core is not working as optimally as it could. And so the good thing, again, is that the pelvic floor physiotherapy approach can really help address those concerns in a very successful way, which is great. Another area is our sexual function. So our pelvic floor basically is a network of muscle, and it's going to be guarding the opening of the vagina. So if there is any discomfort related to any form of penetration, it could be suggested that the pelvic floor may have a little bit more tension than it needs to. Some women might report just pain with intercourse. They might experience actually like the feeling that there's just not enough stretch in those muscles to achieve any form of penetration at all. And then also on the other side of things, some women who have no pelvic pain may also experience challenges around the function of their arousal or ability to achieve an orgasm that maybe before they were okay and could achieve that. So that can also be suggestive that those muscles need some help to achieve that again. So that's important. And lastly, I'll just talk a little bit about pregnancy. So we often see a lot of women during pregnancy who may have symptoms that I've just described of any kind, but I kind of look at it a little bit also as it's important to remember that your pelvic floor is under that baby. And so we want to often help women in pregnancy optimize the function of their pelvic floor so that they can have a good pregnancy experience and feel functional and do all the things they want to be doing. And then also with preparing them for recovery afterwards so that those muscles again resume all those important functions that we want them to, so we can be as functional as we want to be. So I hope that is giving you a little bit more information about what the pelvic floor muscle functions are, and sort of things just to keep your mind aware of in terms of if you have any signs or symptoms, and maybe you might want to take a look at having a pelvic floor exam and seeing if you can find a way to address those issues so you can be doing all the things you want to be doing in life. So thank you so much for listening, and take care.